grandfather of this patient who was bearing the cost of the treatment. He went to a consumer court saying that the deformity is still there. As per a Supreme Court judgment, there should be four important components of this informed consent.
These days, a lot of social media reels are out giving out medical information and medical treatments,
Right.
and the general public tends to follow it.
Correct.
What is the medico-legal aspect on this, sir? Hi, I'm Dr. Aditi, and welcome to a new episode of my podcast series Talk Tonic, India's leading podcast channel for health and medical science, wherein we give you vital information which you will not be able to get in any other source because it's been given directly by leading experts from the field. So, on today's podcast, we have come up with a special guest who is a medico legal expert, and not just that, he's also a dermatologist. There are very few medico legal experts in this country who understand the nuances of this particular special field. And so, for that, today we have on our show Dr. Sirur. Dr. Subodh Sirur is a well-known medico-legal expert in the country, and he has handled a lot of sensational cases. So thank you so much for being on the show.
Thank you.
So today, a lot of patients have misunderstandings with the doctor when they are in a busy OPD outpatient clinic visiting busy doctors. And a lot of times, doctors also feel that the patient did not give me vital information, or it was not possible for me to get all the information possible. Right. This leads to a lot of dispute during the clinic hours.
Correct.
How can one minimize this doctor-patient dispute on an outpatient basis, that is on a clinic, day-to-day clinic basis?
Right. Generally, when you go to a doctor, it's always advisable, especially if the doctor is very senior and he has a busy practice. So we need to have a optimal utilization of the time that the doctor gives or you have with that particular doctor. So in such a case, it's always good to make points about what ailment you have.
Maintaining like a book or a small piece of paper.
Some points so that the whole history is given. Otherwise, what happens is after they go out from the consulting room, they remember something and they'll come back and say, oh, I forgot to tell you this. So this causes a lot of issues regarding time. So to save time, it's always good to make points about what disease you have, what treatment you have taken in the past, or the investigations you have done.
And what expectations they have from the treatment.
Exactly. So many times, they don't carry the prescriptions or the investigations done in the past. Then you need to do these investigations again. And then they say, oh, why did you get the investigations done again?
Correct.
So if these investigations have been done, then you can see in the light of these investigations whether new investigations have to be done or what treatment can be given on the basis of the previous investigation. And if you don't bring the previous prescription, then you tend to give the similar kind of treatment because the protocols are such that you start with a one line of treatment. If there's no response, you go to the next line of treatment. So that kind of problems will not arise if you bring all the prescriptions so that the doctor has an access to what information, what treatment you had taken in the past. So this would minimize the issues that a doctor has with the patient and the patient has with the doctor.
A lot of cases arise during emergencies at night, especially in the pediatric and medical emergency services.
Correct.
Wherein patients come in critical conditions.
Correct.
For example, recently there was a case where a small child who was dengue positive was brought into the emergency services by their parents. He was already in a pretty bad shape when he was brought to the hospital. And within a few hours, his condition deteriorated. He had to be taken to the ICU.
Right.
Now, his condition worsened with time. At such a point, the patient's parents do tend to blame the doctors a lot of times, thinking optimal care was not given at the right time.
Correct.
How to handle such a tricky situation? on both sides,
Correct.
patients and
All
doctors.
right. I would suggest that you should not be waiting till the last moment till things get worse.
Yes.
We tend to take some homemade remedies, or
Yeah.
we take remedies from friends, those who are not qualified doctors. Further, we wait and watch.
Yeah.
Many patients think that things will get better on their own. So it's advisable not to go for that. Take medical care, especially in elderly people as well as in children, because things can turn for the worse at any time. So it's always better to have medical supervision whenever treating any patient. As far as a doctor is concerned, if there's a team of doctors, a team can start treating the patient immediately, especially if the patient is critical, and maybe one of the doctors can talk to the relatives, because the relatives are more concerned about what's happening to the patient, and many times they feel that this has not been done. So someone needs to talk to this parents or the attendants who are coming with the patient, and they need to be informed कि this is the status of the ailment and this could be the prognosis. Many times patient is critical and you cannot give the prognosis immediately. It may take 48 to 72 hours before you can actually decide what the patient has, how the patient will progress. Patients and their relatives many times think that the complication has begun only after coming to the hospital, or the treatment has not been started on time. But to assess the condition of the patient sometimes needs time, because you may have to do a MRI, you may have to do a CT scan, and number of blood investigations. The reports do not come immediately.
Correct.
So because of this, the assessment may take a certain amount of time. So after that, the doctor is able to actually give you a prognosis, and the more delay you do, there's something called as golden hour. If you come within that certain period of time, the prognosis become better. Say
The chances of survival are better.
better.
Yeah.
Like you mentioned about dengue fever and all that, sometimes there are some forms which are very severe forms where bleeding can happen. So if the patient has developed that bleeding and all, the mortality rate, the chances of patient dying of the disease becomes higher. So we should not be waiting for that situation. As a patient or a relative of a patient, we should go to a doctor as early as possible and take treatment early. And it's always advisable for doctors to inform what's the status of the patient, how the patient will progress, or how is the patient responding, and what treatment needs to be given.
Understood. I think a communication gap is a vital reason why these disputes
Right.
arise, which can be tackled better in an Indian
Right.
scenario.
Further, what happens is one tends to go to the nearest nursing home, and
Okay.
many times there may be less number of facilities available to treat that ailment. Then you need to transfer that patient to a higher center,
Correct.
which may have better facilities than the nearest place that you have gone. So, after the assessment, the doctor may refer you to a higher center, not because things have worsened at the hospital, but the condition is critical and needs care which is available in some center which is not available at that center. So merely because the patient has been shifted does not mean something is wrong at this hospital.
Correct. Got it. Got it. So, in continuation with this question, I want to know that when bad news is to be broken to the patient,
Right.
when a doctor has to tell the relatives that the patient is going to die,
Right.
is extremely critical, and to expect the worst,
Right.
a lot of times patients are not able to accept this information,
Correct.
and how to tackle this issue on both sides,
Right.
breaking bad news.
All right. This is a very sensitive thing, and as doctors as well as patients, we need to be very conscious about the fact that as doctors we need to deal it in a very proper manner, because the patients many a times know they have brought the patient in a critical condition, and possibly the patient could die. Like somebody who has got trauma after an accident, he has multiple areas where there are fractures, or patient is bleeding, or the disease has progressed to a very great extent. They could possibly be aware that everything is not really good, but and nobody wants to see their beloved ones dying, right?
Yeah.
But there we have to understand the limitations of medical science, and so for the doctors, because doctors cannot treat a patient who is practically in a moribund condition. So that is why an early bringing to a hospital always is for the benefit of
So I'll
the.
just interrupt. Can
Yeah.
you just tell what moribund means to the
Moribund is
audience?
in a very, very critical stage, patient almost dying.
All
So,
right.
yeah. So that is a way in which it should be done, and maybe you have to sit with the patient, give some 5 or 10 minutes to explain why this situation has arisen, what is the critical aspect of this condition, and what you are doing to prevent it. And maybe if it cannot be prevented, eventuality could be death. And if there is a possibility of transferring this patient to another center, that option should also be given. Many times, it is this information is given by a nurse who is recently recruited, or a very junior doctor,
An intern doctor.
inter doctor. So they may not be in a position to gauge the condition, or the mentality of the patient and what they are going through. So a better understanding is always necessary. Just don't break the news. Nobody likes it.
These days, a lot of social media reels are out giving out medical information and medical treatments,
Right.
and the general public tends to follow it.
Correct.
What is the medical legal aspect on this, sir? And how harmful can this be for the society? Because if you know, recently a famous Indian cricketer did talk about his wife getting Ayurvedic treatment for cancer and it did work out for her. But this could have repercussions on other cancer patients who are on allopathic treatment for the same.
Right.
So, how to go about this, sir?
In some form, this is almost like quackery. If it is the information, medical information is given by people who are not qualified to speak on that subject, then it can amount to almost quackery. So there are a lot of influencers who talk on social media, which is beyond their jurisdiction or their domain. One should stick to your own domain. There are a lot of people who talk about exercise, fitness, or ailments, and uh,
Diet and
diet.
ingredients,
Yes, yes.
nutrition.
So unless they are qualified in that field, one should refrain from speaking, and that could amount to quackery, because there can be repercussions for the general public who find it very sensational. If you are told that you can lose weight by just doing or having some powder, and in fact it does not have those capabilities or those functions, then it can be even deleterious, because we don't know what the composition of those products are. Something which looks very, very great may not be great. Also find out whether this social influencer, the one who is making post, is really qualified in the field.
Yeah.
Qualified in the field is not only being a doctor, but he has to be a specialist in that field if he has to make opinions, because these social posts will go all over the place, and then there will be certain individuals who are looking for such information, and they consider this to be gospel truth, and they start implementing it. And they may, there are certain products which are made not the way that system permits, and there will be heavy metals that may come up, or some other poisonous things that may crop up, which you will not understand immediately, and later on there could be problems.
Okay, got it. So these days, after getting some kind of cosmetic surgery or surgery for whatever reason, let's say a nose job, a lot of patients may be unhappy with the outcome.
Right.
And then they go and address the doctor with their previous expectations.
Right.
The doctor also is not aware of these expectations, etc.,
Right.
etc.
Right.
This leads to a lot of grievances.
Correct.
How can this be overcome?
Right. This problem is mainly in the aesthetic procedures that there is a grievance because uh, the unexpected or unrealistic expectations can happen. Therefore, a dialogue between the patient who is seeking this kind of treatment and the doctor has to happen, and this dialogue has to be in detail because many times the patient expects something and the doctor obviously cannot give to that extent. So unless you have a realistic expectation, there are certain systems now available where you show what could be the outcome after this surgery is done. The patient also needs to be explained, when you take a consent, you have to take a consent.
Sorry to interrupt. These systems where they can see the outcome, it's like a 3D
Correct, correct,
structure or
correct,
some
correct.
artificial intelligence
Right.
tool that can show them how they look after the
Correct, correct.
surgery.
Even if these tools are not available between the doctor and the patient, still the patient needs to be told in detail about what to expect from this procedure and what not to expect. Both of these are very important.
So, should this be only verbally or even on paper? It's
Yeah,
necessary to
yeah.
have this.
I was about to come to that. A consenting process is very vital whenever a procedure is done. As per a Supreme Court judgment, there should be four important components of this informed consent. The first component being that the patient should be told what is the nature of this problem. Like you have a nose job, you have a deviated nasal septum, or there is some reason why you need to be treated for this. Second is what are the options available for this, whether it can be left alone, whether it can be treated surgically or it can be treated medically. If it can be left alone, you should inform the patient that
Okay.
this is only for cosmetic reasons that we are doing this procedure. Thirdly, what are the complications uh, with this particular procedure? So these complications are sometimes specific to that procedure. Secondly, it could be specific to that person. Now, if the patient is a news reader, right, or a reporter, or someone who has to face the camera or the public on a daily basis, for them their face is more important. So their outcomes, they would not accept any complication as an outcome. So that is known as trying to find out what the expectation of the patient is.
Okay.
Or sometimes the patients are in a hurry, in the sense my wedding is 2 weeks later and my face should look fair. So will that happen? Now you have a condition which does not go in 2 weeks and you have to do multiple sessions. So the patient needs to be told that there is a time frame for which you have to do these procedures and there are multiple sessions that need to be done. So in such cases, if this information is not available, then obviously there could be a grievance. So a written informed consent should be in place which outlines all these points. And the last point, maybe not in the aesthetic procedures, it's not so important, adverse consequences of not doing that procedure.
Okay.
So in aesthetic, you will not look, you look the way you are today. But say if it's a appendicitis, you need to remove the appendix. Then if you don't remove, what would happen? It would progress. Maybe things will burst inside. You may get complications. Is what you need to say, because if these complications are not informed to the patient, they'll think, what will happen if I don't do this? Why is the surgeon asking me to do this procedure?
Also, the possible complication of death. Death is something that can
Correct,
happen in any
correct,
procedure.
correct,
Even if it is an outpatient procedure being done
correct,
in a clinic, a simple procedure could
correct,
lead to death.
correct,
And even a major operation could lead to death. So, patients need to understand that it cannot always be something that is completely controllable. It can just happen to anybody.
correct. Even simple things like sensitivity to the local anesthesia that you're giving, general anesthesia, has its own complications, and
Correct.
death has happened in cases where you have least expected it. So sensitivity to drugs is also very well known.
Correct. All right. So this, since you mentioned about reactions to anesthetics, etc., I come to my next question that a lot of times patients develop reactions after taking a particular drug,
Right,
and then they directly go and want to blame the doctor about
right,
these
right,
reactions. Is these do these drug reactions occur so commonly, and how can this be prevented on the patient's and the doctor's part?
right,
This miscommunication about a particular drug, because we know that any drug
right,
today can give a severe reaction, possibly in the
right,
rarest of cases that could
right.
happen to anybody.
Correct.
For the patient to understand this, what would you tell the audience?
Right. So something that has an effect can also have a side effect. So
Yeah.
this is to be known, and as a doctor, it's incumbent on us to inform the patient the material side effects, because it's impossible to tell all the side effects. When you take a particular medicine, the prescribing information comes with the medicine. Somebody who's inquisitive can go through it, because it's available for you to read, the patient also to read. But for the doctor, it's important to give the important side effects, and it's a good practice to ask the patient if he or she had history of any drug or medication allergies in the past, because if they have taken it in the past, possibly they will develop it again. Though and not only the doctor needs to ask, the patient also needs to volunteer, because if they have history of drug allergy in the past, they should volunteer it, even if they had come to the same doctor before, because the doctor sees so many patients, he would not remember everybody's history. So it's important to volunteer that information, and it's also important for the doctor to ask wherever possible whether there is drug allergies, because it's not always possible to determine beforehand if this particular medicine is going to cause an allergy. There are certain drugs where we give a like penicillin, we give a test dose before we start penicillin. So not every medicine has that test dose kind of protocols. So it is difficult to predict which patient will develop a reaction. Some develop very minor forms of these drug reactions, some develop severe forms. No doctor wants to give you a medicine and cause you more harm, because many times people just take what has been prescribed in the past or prescribed to a friend of the patient, and then they develop these reactions which are very difficult to manage, or it could become critical in very unfortunate cases, though it's very, very rare.
Sir, any interesting case that you have ever come across in your career which was extremely challenging and difficult to manage,
I had a
medico-legally
Yeah,
speaking?
I had a case of a plastic surgeon where a child had some deformity of the ear, and for you need a cartilage to form this ear properly,
Okay.
and the cartilage is available from the ribs.
Ribs.
So it's taken from the ribs, and reconstruction of the ear is done. Now, this was obviously a young child, and plastic surgery or reconstruction takes money. It takes
Yes.
more money than the routine surgery, because it's a very skilled kind of surgery. It's done by a super specialist, and reconstruction of a ear by itself is a little major surgery. So the grandfather of this patient, who was bearing the cost of the treatment, he went to a consumer court saying that the deformity is still there. He's taken it from the ribs, and he has practically mutilated my grandson. But the point was not that, because this is a standard protocol that you need cartilage from your own body. You can't take it from somewhere else. So it's a standard protocol. It's mentioned in standard textbooks.
So was it not informed to the patient?
It was definitely informed. There was a consent form in place. But what happens is what has been told to a relative or the patient at the consenting process is many times conveniently forgotten.
Okay.
Because they feel the doctor is not doing his job properly, but uh, the process goes okay, I've understood everything.
All right.
If you have not understood, it's your right to ask further questions. So let the consent process end by understanding, not by hurrying with the process. But what the grandfather didn't tell the court is that I have been told that multiple sessions are required. You need refining. Even in hair transplant, many times refining of the hair margin is important. So certain aesthetic procedures need this multiple sessions. If you're going for something expensive like this, you should be available with the financial resources, because a point may come where you feel, oh, I can't bear it, so let's blame the doctor. That's not a correct position.
Thank you, sir, for
Yeah.
all the vital information that you have given us today. Thank you
Right.
for being on this podcast.
Right.
So, if you've got something important out of this podcast, which is going to be very useful for you in your future life, then please do like, share, and subscribe to my channel. This is one of the very few channels on medical science which will be giving you authentic information, which is not going to be incorrect at any point of time. So, please do hit that bell icon so that you do not miss out on any of the future episodes. Thank you.